Hi guys, welcome to our today's tutorial, and walk with me as we're going to learn about perioperative nursing. Okay, perioperative nursing is divided into three phases, major phases that is it. In the first one being preoperative nursing or phase, the second one being intraoperative nursing, the third one being postoperative nursing. But today we just gonna base in one phase because if I decide to discuss the three phases, this video is gonna be long, and it's gonna be long for you to concentrate on and focus on. So that's why I decided to divide them in three parts. So let's tackle one at a time, starting with perioperative nursing or perioperative phase. This perioperative phase is whereby, or it starts from when the client or the patient has decided or has agreed to undergo a certain procedure or a certain surgery, until the moment when the patient has been laid to the operation bed. And what does preoperative nursing care entails? We've got the first one, assessment, whereby the patient has to undergo a perioperative assessment, whereby as a perioperative nurse, you have to undergo you also have to review the health history of the client that you're preparing for a certain surgery. You also have to assess the physical needs. You have to assess the psychological needs and also the cultural needs. And we go to the second one, whereby the patient or the client has to sign the consent form, bearing in mind that a patient can't undergo any procedure or surgery without or if he or she hasn't signed the consent form, the patient can't undergo any procedure. So he or she must sign the consent for in order to undergo the procedure. We've got the third one, whereby the patient has to undergo teaching. This is whereby you teach the client about the procedure he or she is going to undergo. For instance, if a client is going to undergo amputation, you have to state it clearly to him that you're going to undergo amputation and this is what's gonna happen to you, in order or for the patient to be aware of what is going to happen to him or what he should expect. The other one is whereby one has to fill the checklist, the perioperative checklist, whereby you have to confirm if the patient has any allergies, has any dentures or jewelries, drug, and the fifth one is securing the patient's belongings. As soon as the patient is ready for the procedure and he's taken to the OR, his items are kept or are secured so as they don't get lost. Now we've got the sixth one, the patient identification, whereby you have to confirm if he or she is the right patient who has to undergo that specific surgery. And you can identify the patient by, if he or she is conscious, you can either ask the clients to say his name, being operative site marking or site preparation, operation site preparation, whereby you have to prepare the site where the operation or where the surgery is going to take place. For instance, if a client is going to undergo craniotomy is the surgery that pertains brain, the opening of the skull. Yeah, if the patient is or has to undergo craniotomy, before going to theater, it actually depends. There are some theaters that you're gonna go and meet that the shaving is being done inside the theater, and the others, the shaving is done in the wards. So you do it according to the protocol of the hospital. So if the protocol of the hospital states that the patient should be shaved in the ward, then you should do so in the ward. You should shave in the ward before taking the patient to theater. And as we come to the end of session, please, I urge you, if you haven't yet subscribed, please consider doing so. Until next time, the same place with me, Glory Kanyenye.